get a student perspective, and we have with us Marie Hauerslev, who's the Vice President for External Affairs at the International Federation of Medical Students Associations. So, please.
Thank you so much, Ambassador, and thank you as well to the Graduate Institute for inviting us here today. We really appreciate the emphasis on youth and having a young person on the panel today. So I've been asked to talk about why the WHA is important to us, and really I think there are three things. So first of all, to mobilize young leaders, to advocate, and to build and strengthen the partnerships that we already have. So regarding mobilizing young leaders, IFMSA represents 1.3 million medical students all over the world, and most of these work at the local level. But bringing them to the WHA gives them and us an opportunity to expose them to the global level and see what is going on at the global agenda that they can bring back to their countries and their local and national context. And how do we prepare our delegates? So what we do is that together with the Graduate Institute again, we organize a 4-day capacity building workshop where we're focusing on some of the global health diplomacy skills and also some of the most important topics for us in the upcoming assembly. And going into what are the most important areas for us at this World Health Assembly also touches on what is the advocacy that we're going to do. And first of all, we're going to work on migrant health. So for us that means people on the move, that they also have the right to the highest attainable standard of health. Secondly, adolescent health, a generation that has been neglected through many of the last few decades. Health-wise, we haven't seen the same kind of health improvement in outcomes. And also, adolescence is obviously an age group that's very close to us, so therefore it's also important for us. And then NCDs, of course, the biggest killer of them all. And what we're specifically focusing on is that actually 70% of the premature deaths due to NCDs are caused by risk factors that started in adolescence. And then lastly, also human resources for health, of course. As doctors in training, we are exposed to health systems that are not meeting the needs of the populations. And also we're seeing doctors working in unfair conditions, and also some of our colleagues in conflict situations are actually under attack. But of course we have all of these ambitions, but we realize that we cannot achieve anything on our own. And that leads me to the point about partnerships. So, as has been said a few times, partnerships and this WHA is a unique opportunity to meet everyone, basically who works in global health. So we also use this opportunity to meet with our partners, strengthen our partnerships, see what things do we want to work on in the future. And we also get inspired by the different events and the things that the WHO is putting on the agenda. I wanted to bring forward an example of a good partnership between us as a youth organization and another institution. And what we did, as I said, we're really concerned about NCDs. And also we really want to be involved in the lead up to the high-level meeting in the UN in 2018. So what we did was we partnered with the WHO Global Coordination Mechanism for NCDs, and we organized a youth NCD corpus in Montenegro, and parts of this was attended by more than 800 medical students. After debates and dialogues and so on, we adopted a WHA Youth Declaration, a call to action on NCDs, and some of the findings there are actually quite interesting. So I wanted to highlight that 75% of our 128 national member organizations do not find that their medical education prepares them well enough to tackle prevention, taking into account also social determinants of health when they're treating these patients with NCDs. So 75% are actually not educated to be ready to respond effectively to NCDs. And going into how youth participation can work and what we want, I really think that if we find joint interests on some matters, then we can find ways where, of course, young people, I know I work with them every day, and there's lots of them sitting up here. They are bright, they're well educated, they're driven and innovative, and also we grew up with technology, so that can also be used. And then I think we really want to be involved both from idea or identification of the problems into the policy creation and also into the implementation of policies. And at all levels of society, I know medical students and other young people that are interested in being engaged. So, as Ban Ki-moon said, young people are the world's greatest untapped resource. And if you are a country delegate, I'd like you to think about whether you could have a country, whether your country should have a youth delegate, or if you're working in policy making, whether you could include more youth young people in the health policy creation. And lastly, I'd just like to say that if you need any inspiration or more background on what we're working on, they're spread out a little bit, but we have more than 50 delegates at the World Health Assembly, so feel free to talk to any of us. Thank you.